Dear students, we are going to learn another topic, angle block. So I'll be talking under the following headings. What is angle block? What are the indications, contraindication, complications, how to avoid complications, the procedure itself, and the post-procedure management. So angle block is a type of regional anesthesia blocking the five nerves that are providing sensory innervation to the region of the food distal to the malleoli. So the indications of angle block are lacerations, fracture reductions, and exploring wounds in and around the angle and the foot. The contraindications for angle block are the infection in and around the site of the block, allergy to local anesthetic. Usually we use lidocaine or bupivacaine for local giving angle block, and the patient refusal. Coming to the complications, they are local anesthetic toxicity, which can manifest as mild, moderate, and severe toxicity. So in mild toxicity, the patient will be having perioral numbness, metallic taste, paresthesia, tinnitus, and severe cases, moderate cases, they can have confusion, seizure, and they can have cardiac toxicity. And severe cases, patient can go in for coma and prolonged seizures, cardiac arrest. So this is about the local toxicity. Local toxicity itself is another topic. Next is infection. Next complication of angle block is infection in and around the angle block area. Then the vascular injury due to the vasospasm during the angle block. Now how to avoid complications? The first step in avoiding local anesthetic toxicity is correct calculation of the dose of local anesthetic. If we are using lidocaine, it should be lidocaine without adrenaline 1%, 3 to 4 milligram per kg. And if you are using bupivacaine, it's 0.25%, 2 milligram per kg without adrenaline. And then we should keep the antidote ready. The antidote for local toxicity is IV intralipid emulsion 20%, and the dose is 1.5 milligram per kg IV bolus followed by an infusion. Then third one, strict monitoring of the patient during the angle block and early recognition of the signs and symptoms of local toxicity, and treat symptomatically for mild and moderate toxicity. And if the patient is having severe toxicity, consider intralipid. And if the patient is having seizure, consider giving benzodiazepines. And if the patient going for cardiac arrest, manage according to ACLS or ALS cardiac arrest algorithm and give intralipid immersion. Then the next complication, vascular injury, can be prevented by using either a nerve stimulator or an ultrasound. Then infection can be prevented by sterile technique. So the procedure, first step in the procedure is identifying the landmark. So identifying the anatomy and the nerve supply of the angle and the foot. This is the most important step in this angle block. If you know about the anatomy and the nerve supply, then it's very easy. Then the preparation of the patient, preparation of the equipments and the doctor, and then preparation of doctor and nurses, then the procedure itself. So if you know the landmark, the procedure is easy. The five landmarks are medial malleolus, lateral malleolus, extensor hallucis longus, tibialis anterior, and Achilles tendon. So coming to the nerve supply of the ankle and the foot, we have five nerves supplying the ankle and the foot. Sensory supply, five sensory supply. So we have two deep nerves and three superficial nerves. So we have three deep nerves and three superficial nerves and we have two deep nerves. So the superficial nerves are superficial peroneal nerve, saphenous nerve, and the sural nerve. Deep nerves are the deep peroneal nerve and the posterior tibial nerve. So this is the anterior aspect of the foot or the dorsal aspect. This is the plantar aspect of the foot. This is the lateral aspect and this is the medial aspect. So the anterior aspect of the foot is mostly supplied by the saphenous nerve. This yellow color is saphenous nerve, superficial peroneal nerve. Is mostly supplied by the superficial peroneal nerve except in the first and the second web space area and a small area just proximal to the first and second toe on the plantar aspect of the foot. This area is supplied by the deep peroneal nerve and medial aspect is supplied by the saphenous nerve. Lateral aspect is supplied by the sural nerve. The plantar aspect mostly supplied by the posterior tibial nerve except a small area between first and second web space area which is supplied by the deep peroneal nerve. Lateral part is supplied by the sural nerve. The lateral aspect of the foot is mostly supplied by the sural nerve except a small posterior area which is supplied by the posterior tibial nerve. Medial aspect of the foot is supplied by the saphenous nerve with some contribution from the posterior tibial nerve. So this is about the nerve supply of the foot and the ankle. So always remember sural nerve supplies lateral aspect. So sural nerve supplies lateral aspect of the foot. So lateral sural. Okay. So some more clarification regarding the nerve supply on the plantar aspect of the foot. Plantar aspect is mostly supplied by the posterior tibial nerve except in the first and the second web space which is supplied by the deep peroneal nerve and the middle part which is supplied by the saphenous nerve and lateral part which is supplied by the sural nerve. So the posterior tibial nerve on the plantar aspect has three branches. Medial plantar nerve supplies the medial part. This is the medial plantar nerve supply area, and then the lateral plantar nerve, and then there is the calcaneal branch. Okay. Coming to the preparation of the patient position, supine, and the foot of the corresponding foot should be prepared and should be cleaned. You should clean the entire foot before starting the procedure so that we can change his or her body position and reposition the patient's foot as needed to avoid the awkward reaches when accessing all the 5 sites. So usually we prefer blocking all the 4 nerves because all the 5 nerves because the anatomical landmarks can vary because there is some anatomical variability of the 3 nerves or the superficial nerves. So we can block these nerves by depositing the local anesthetic agent as a field block in the subcutaneous space in the area through which the nerve travels. So we should identify the landmarks. Extensor hallucis longus, tibialis anterior, the medial and lateral malleolus, and the Achilles tendon. That's about the patient position. And if we are blocking according to the block which now we are blocking, we should rotate the foot outward or inward or in neutral position, or sometimes we can use if we are not able to do in supine position, we can do it in prone position as well. Now coming to the preparation of the equipments, as I told earlier, appropriate resuscitation equipment and medication, towels, gauze packs, pen, marking pen, 10 ml syringes, needles, local anesthetics. Then preparation of the patient, doctor and the nurse wash hands and wear PPE. Now we will mark the landmarks. First we will mark the posterior tibial. It's usually its posterior tibial is just behind the middle malleolus. We'll mark the point here. Okay, posterior tibial is behind the middle malleolus. Then the deep peroneal, it's in the anterior aspect of the foot, in between the external hallucis longus and the tibialis anterior. So how will you identify tibialis anterior and extensor hallucis longus? So the extension of the big toe against the resistance will help you to identify the external hallucis longus, and the dorsiflexion and the inversion of the angle will help to identify the tibialis anterior. So in between this tibialis anterior and the external hallucis longus, this is the point where we will give an injection to the deep peroneal nerve to block the deep peroneal nerve. Then the sural nerve, the mark is in front of the lateral malleolus. Then the superficial peroneal is also in front of this area, lateral malleolus, and saphenous nerve in front of the middle malleolus. So this is about the landmark. So we'll mark this with a marker pen, and then we'll start the procedure. So now we will go to the procedure. We'll block each nerve. So we'll block the deep nerves first, because if we block the superficial nerves first, this will distort the anatomy, surface anatomy. So now we are going to block the deep peroneal nerve. The location, the landmark, a point on the anterior aspect of the foot in between the external hallucis longus and the tibialis tendon, just above the middle malleolus. Okay, and the direction is perpendicular. So the direction of the needle is perpendicular. So take the preloaded syringe with containing 3 to 5 ml of lidocaine and direct in the anterior aspect of the foot in this point, and then give a subcutaneous wheel and then inject deeply. So this is about the deep peroneal nerve. And the position of the foot should be neutral. So deep peroneal nerve blocking, we should keep the angle and the foot in neutral position. So now we will block the posterior tibial nerve. Posterior tibial nerve lies posterior to the posterior tibial artery. Posterior tibial artery and nerve lies posterior to the medial malleolus. So this is the medial malleolus. Just posterior to the medial malleolus, we will palpate the posterior tibial artery pulsation, and just posterior to the posterior tibial artery pulsation, in this point, we will direct and we'll infiltrate a superficial wheel. First we will infiltrate the superficial area and make a superficial wheel, and then deep till it struck the bone, and the direction of the needle is perpendicular to the line passing through the first toe. There is an imaginary line passing through this first toe and the middle malleolus. This perpendicular to this line will infiltrate to block the posterior tibial nerve. And the position of the foot is, patient can be in supine position with foot rotated outward, and or the patient can be positioned in prone with foot rotated inward. Okay. Now we will start blocking the superficial nerves. First superficial nerve, superficial peroneal nerve, which supplies the anterior aspect of the foot. So the direction is the landmark is the just anterior to the lateral malleolus. So we'll start injecting from the anterior part of the lateral malleolus to the posterior part. So the direction is always from the anterior part to the posterior part of the lateral malleolus. So this is the direction. So just above the lateral malleolus, we'll start infiltrating from the anterior to the posterior part of the malleolus. Direction from anterior to posterior part of the malleolus to block the superficial peroneal nerve. And the position of the foot is, patient is supine, foot rotated inward. Okay. Now we will block sural nerve. So sural nerve supplies the lateral aspect of the foot. So the position is in supine position with the foot rotated inward, or the patient can be in prone position with foot rotated outward. So the first we already not identified the landmark. This is the space between the lateral Achilles tendon and the lateral malleolus. So first we will inject 5 to 6 ml of anesthetic solution in the superior portion of the lateral malleolus superficially. Then we'll create a subcutaneous vein, and then we'll inject deeply in this area from the lateral malleolus, posterior part of the lateral malleolus to the anterior aspect. Okay, and this is about the sural nerve. Now we'll block the saphenous nerve in the medial aspect. We have already marked the anatomy, so we are blocking in the medial aspect from the anterior part of the middle malleolus to the posterior aspect of the middle malleolus. Okay, so and the position of the foot is in neutral position. So we have blocked the 5 nerves, 2 deep nerves and 3 superficial nerves. Once again, I'm repeating the anatomy and the direction of the needle. So the posterior tibial and the deep peroneal, these are the deep nerves. We are blocking the deep nerves first. Posterior tibial, posterior to the middle malleolus, behind the posterior tibial artery, direction perpendicular to the line joining middle malleolus and the big toe, posterior to the posterior tibial artery. Okay, then the deep peroneal nerve, the anterior aspect of the foot, and its direction is perpendicular to the external hallucis longus tendon and tibialis anterior. Okay, this is the direction of the deep peroneal nerve. And the sural nerve is in the lateral aspect. So we are blocking the sural nerve by injecting from posterior aspect of the lateral malleolus to the anterior aspect. Now superficial peroneal nerve we will block from superficial part of the anterior part of the lateral malleolus to the posterior part of the lateral malleolus. Now saphenous nerve. So saphenous nerve, it's in the middle part. So we will start from the anterior aspect of the middle malleolus to the posterior aspect. Okay, so this is about the 5 nerves. So that's all about angle block. Thank you. If you have any doubt, please email me. Thank you.